All right, so I want to welcome you all to Royal Ladies Maiden event in 2021. We are privileged to have Dr. George Owusu from GEVANS Medical Practice with us to educate us on these COVID-19 vaccines that it's available to all of us. I know there's a lot of questions and concerns. People are confused. But today we are blessed to have Dr. Owusu to come and educate us and give us that peace of mind and just so that we can make informed decisions. So I welcome you to this program. Doctor, we welcome you and we pray that everything that you're going to teach us will fall on good grounds. You're welcome to Royalhouse Chapel one more time.
Thank you very much. I'm an honorary member of the church already, so I don't need any introduction. Anyway, before I talk about the vaccine, first we have to understand how the COVID came in a small historical background, and then why we have to be worried about it and why there's a need for us to get the vaccine. Because some people get upset, why do we have to get vaccine? Why do we have to get this? Why do we have to worry ourselves with all these vaccines? Okay.
Yes.
You see, what is COVID? COVID. The COVID, everybody talk about. Well, how did it come about? Originally, the COVID virus wasn't a virus that attacked human beings. It was a virus that attacked animals like bats in the bushes. That, for some reason, because of human activities,
Okay.
this virus decided to find their way into humans. And I would like to give you a little...
Excuse me, doctor, please. Put the mic
close
so
to me.
that we can
Yeah.
hear it. Thank you.
You hear me now? Okay. Initially, what I wanted to say is that first we have to understand why we are so much concerned about this COVID vaccine, COVID and COVID. So I want to talk a little bit about how the disease came about and why there's a need for us to get the vaccine. Everybody beginning was talking about COVID. How did it come about? Originally, the COVID virus wasn't a virus that were found in human beings. They were viruses that were attacking animals like bats who are in the bush. But what happened was that because of human behavior, this virus find our way in us. How did they get to us? The reason was that there was a place in China they call Wuhan. What happened is those people, they like snakes and these reptiles. So what happened was the snakes also attack bats in the night to try to eat them. And in doing so, these snakes got infected with the COVID virus. And then, because human beings, we try to eat these snakes raw in China, what happened was that the virus find their way in humans. And when they got to us, they realized that, oh, okay, now, initially we were attacking bats, now we found a new host. And these people, they have other things that are very attracted to us. And virus said that once you find a host that will produce what they need to replenish, like to multiply, then they tend to cause that. But originally, the virus was not to kill us. It was a way that they have found a new haven. They want to live like human beings. You move from Ghana to America, you marry, you live here, and you enjoy. You are not here to destroy anything. So the virus, when they find human beings, they found out that there are things in us that were very good for them to produce more, and in doing so, they cause damage to us. How did it happen when they get into contact with humans? Initially, when people start eating the raw snakes, this virus got into humans, and for some reason, not everybody that got exposed to the virus got sick. How the virus does to the human beings is only about 3 sessions. For example, for some people who got in contact with the virus, they got mild disease like sore throat, a nasal congestion, and then like a normal flu. and then they leave. But for those who were like immunosuppressed, who were sick, like people with end-stage kidney problems, diabetes, organ transplant patients, and those who are cancers, their immunity was so low. So the virus decided that they would further attack them. And in doing so, some of them find the disease in such a way that the virus attacks the lungs. But what it does to the lungs is what I'm going to try to explain to you. Under normal circumstances, you see that when something goes into our lungs, what do? The body decides to cough it out. What this virus does is that when it enters into somebody who is immunosuppressed, it reverses the way that we are able to clear our throat, so that all this mucus gets stuck in the lungs. And there's a portion in the lungs where oxygen comes and exchange with the blood in such a way that the good air, that is the oxygen within the air we breathe, will go into our body, and then the carbon monoxide that the body don't want will come out. What this thing does is that the virus causes this cilia in our lungs, reverse and produce a lot of mucus. So this mucus form like when we make starch. So it covers the whole area where the exchange of air and blood will occur. So in that case, what happened to us? You cannot breathe. And human beings, God created us in such a way that if you cannot breathe, you cannot take in oxygen for more than 6 minutes, the brain will destroy and then you die. So that is the major problem that we were having with COVID. The COVID just find its way, produce more, and then in doing so, it produces a lot of mucus in our lungs, and then if we don't get anything to try to give us oxygen, then we die. I think in the beginning we were worried about people getting on the machine. The thing is that if you are able to survive at a severe form of COVID for more than 3 days, the starch that is built to separate the air will tend to, when you leave starch outside for some time, they turn to water, and now you can do your own breathing. So that's why you say that when they put somebody on the machine, after 3 days, if the person don't come out, then it's over. Yeah, so that's what the COVID virus does to our body. For most people on earth, when they get exposed to it, nothing happens to us. We live. Because I remember that there were some of my patients who initially were saying, oh, I think I don't smell anything. Everything feels different. Even I put glue and I use bleach, but I don't smell anything. They never had anything. So for those people who have good immunity, they were able to consume the virus early, and then they develop immunity. But for the very old people who were immunosuppressed, they were the ones who were dying. Because once the virus gets into your lungs and start reversing the way you are able to clear the mucus, this mucus forms a layer. No oxygen gets into the body, no carbon monoxide comes. Within 3 minutes that you take the person to the hospital, you see that you are talking to this man and he's gone. So having this background, that is the reason why everybody was concerned about the COVID. And then we decided that what are we going to do with how to manage this? And you know from scientific background that we don't actually have proper treatment for virus. What we normally do is that God is so wonderful. He gave us our body a part that if some organism enter into our body, there's a part in our body we call the bone marrow. It recognizes it, and then it produces something against the organ that has attacked us. So then a group of scientists decided that how are we going to go about it to be able to create a vaccine that will form antibody, because if I have something to fight for me, then in that case, when I get exposed to it, the virus will not kill me. I think all of you know about flu shot. You see, every year, people go and get the flu shot. But unfortunately, flu is said that it's very variable. Every year, whatever happens in Japan, they study it, and then we based on it to create a vaccine that every year you have to get it. So because of that, it was worrisome for a lot of people, because we didn't know what to do. There was no tablet that, okay, this antibiotic, you take antibiotic for bacterial infection and you are born. The virus, there was nothing we could do. So God being so good, group of scientists met and then they developed vaccine. When they say vaccine, what does it entail? Because as a person, once you understand it, then if they tell you to go and get vaccine, you will be able to go and get the vaccine. The simple thing about vaccine is that the scientists have decided to take the coronavirus. There's a part of the coronavirus which will cause a disease. The scientists have destroyed, they kill it, and they take a protein that when they introduce it into your body will recognize that, oh, what is this? Oh, there's something. Then let me go and tell my body to produce something against it. So what we are getting now, the vaccine, is attenuated version. That is a dead virus, the coronavirus that has been destroyed. But there's a part of it that your body can recognize that you have got it. The reason being that once you got exposed to the vaccine, your bone marrow will produce something against it. So let's say you meet somebody who has got the rare COVID, and then he cough on you, and then you have the virus into you. Because your body has the antibody in your system, then it will go and destroy it. So that's the rationale for the vaccine. Most of the time, God has been so good to us, for this particular short time, because it takes about 4 or 5 years to be able to develop good vaccine. But for this one, I think you heard about your former president was saying Operation Work Speed. Well, maybe he was lucky. But then something came out, and then they were able to produce vaccines that was able to do more work than what even the normal flu vaccine that you got. How it worked, only about 40 to 50%. But these vaccines that we have now, especially with Pfizer one, Moderna one, they are able to produce antibody between 90 to 94% of people. And there's a third one which is running around between 80 to 84%. That's the Johnson & Johnson. These vaccines have become so complex. Because it's the first time in science that we are able to get a vaccine that is so very effective. So, what is the myth behind it? Most people, when God does something, others will have their own way. Somebody will go and sit down and say, I think that all these years, nothing of that sort has come. So why is it that even flu shot, you've been getting flu shot all this time? Now there's a vaccine that works more than flu shot. So because of that, then let me see. Probably it's, maybe Professor Tony and his friends are planning to make money, and that's why they created this vaccine. So they will go and then, because Professor Tony is so nice, he say, you see how he's rich? All these things that they are doing, they sit in a room and creating something. So if you take it, some theorists are going that when you get the vaccine, for men, you may not even be able to be a man again, because they want to find a way to destroy other race and all these things. These are not what those things are for. Those people that they are talking about, they don't need our money. They are already rich. These people, like Fauci is over 80 years. How many years God gave us? He doesn't need our money. They sit down to create something. But there are things that human beings are out there that they are surprised about, the things that God is using other people to do. So in that case, they will say that don't get a vaccine. It will do this thing to you. So long and short of this is that COVID is a very deadly disease. When it happened, initially, we didn't know what to do. And I can tell you that for most institutions, when you go and somebody has got COVID, usually we have 3 or 4 doctors who know how to put the machine into our throat. But because at that time there were very few people who could do, people were just laying down. There was because you don't normally put things in people's throat. We use the term intubation. So a lot of people died that they shouldn't have died. But thank God, with time, things are changing. So with the development of the vaccine, it has become something that we have to educate our people that it is not a bad thing. It's a very good thing that will be able to help all of us. What will you say about it? So far, we have 3 vaccines that are available. We have the Pfizer one that initially, the Pfizer and Moderna, when it was created, they were very effective only at certain temperature that was very lower than even the fridge that we use. But with time, as the research goes on, they found out that they can be stored in fridges that are a little bit higher than what they used to be stored. And thank God, Johnson & Johnson also came with one that can be put in regular fridge. So still good vaccines are coming. Others will come. But what I want you all to know is that all the vaccines that are coming are very effective. They are not dangerous to your body. They are not going to, the benefit that you are going to get is more than you not getting it. But even recent data that came out just 2 days ago, for people who are asymptomatic, like they never got the disease, they receive the vaccine for Pfizer. They are able to prevent, like when they go to old people, like nursing home and other places, they are able to prevent infection about 95%. Meaning that even if you don't want to, if you don't care about yourself for the vaccine, you have to think about your the old people at home, somebody who you live with who is diabetic, somebody you live with who is a sickle cell patient, organ transplant, and somebody with severe immunosuppressed. That you think that if you really love the person, you won't carry the virus to the person. So it is very advisable that each one of us should not listen to the conspiracy theory that's going on. They say that when you take this, this is going to happen to you. It's a very good approach. Other vaccines are going to come. There are others in pipeline. They have AstraZeneca. They also have one that is still working on it, that children up to 12 could be tried on. So they are all, but presently, what we are giving to people are the three main ones. We are, in America here, we are giving the Johnson & Johnson, which is a one-shot dose. It's able to prevent the disease up to 84%. And we have Moderna and Pfizer, which we need one dose, and then 2 or 3 weeks apart, you can go for a second dose as a booster. And then you will be fine. So what I want to end the talk is that COVID is real. You saw so many people that died. With the introduction of the vaccines and then with the introduction of the vaccines and good education, you realize that the disease is falling. And hopefully, if we are able to do well with it, a time will come that I'll say, Tony, I'll give him a big hug. We're going to have a good party. All of us are going to enjoy, as our new president is saying. So I want all of you to stand firm and educate people who have different thoughts about the vaccine, that even if they don't care for themselves, they should care for other people. If they are Christians, and if you know the Bible always talk about we should love our neighbors as ourselves. So even if we think that we have good immunity, we should be able to get the vaccine and prevent and protect other people. And one thing that I also want to say is that you won't be surprised that one day it's going to happen that you remember that if you are somebody who goes to Ghana often, there was a disease they used to call yellow fever. I don't want to divert to that, but the simple thing I want to say is that disease was not a human disease. It was a disease that was affecting monkeys. Farmers went, they decided to kill the monkey. The monkeys came down, mosquitoes bite them, and then they transmit the disease, and people were dying. And they created a vaccine for yellow. Then Americans and other people said, okay, if you want to use our passport, you have to get yellow vaccine before you travel. And most of you who have a Ghana passport, American passport, you have to get yellow vaccination before you even get Ghana visa. So in a nutshell, we're going to have a situation where if you don't have a COVID vaccine, maybe you may not be able to travel to see your loved ones. So I'm just encouraging all of you to try and consider having at least one of the 3 vaccines that are coming. And hopefully, we will be able to get back the way that God wants us to live. So I'll end here. If there are questions, then I will answer them.
Shall we give it up for Doctor? That's one thing I like about Doctor. He never uses notes or books. Everything is in his brain. he's really, really, really smart.
I tried.
So he's done with his presentation. Doctor, I believe that people have questions.
Yeah.
And so at this point, if you can sit down and relax, you can sit down and relax, and so that the questions will be coming to you. We appreciate your time. I know it was a busy day for you, but you still made it to come in here. So now the floor is open for questions. Those in-house and those watching online, you can actually ask questions now so that you can get clarity. You don't want to leave here and not have clarity. That is why we brought him here. So if you have any questions, just ask him. Doctor, before anybody asks you a question, I think I have my own question.
Okay.
All right, so I would like to ask that if you had it, you had the COVID, and you are now immune, do you still need a vaccine? Because the vaccine is to boost our immunity, if I'm right.
You see, under normal circumstance, anyone who got exposed to the COVID virus, and we do the antibody test and you are positive, you really don't need a vaccine anymore. But because it's a new disease, and we don't know the extent of how the immunity will last, that's why that even the expert, if you talk to Fauci, he was saying that for those who have got the disease and they have immunity, you can decide to have the Pfizer vaccine one shot. Because yours is going to be like a booster. Because you already have something that is, your body has developed its own immunity for you. What I want to say is that if you got exposed to the COVID virus and you have antibody test positive, you see that all the vaccines that we are having, none of them is 100%. They gave up to 90, 95%. But for the person who has been able to survive COVID, meaning that you have 100% immunity, because your immunity is the natural one that God has given you, that you were able to survive the disease. You realize that when people were got the disease and they survived, they were taking their blood and giving their plasma to those who were very sick, so that their antibody in their blood will be able to fight for those who are severely sick. So what I'm saying is that for somebody who has got the disease and then has developed immunity, all that you need is just a booster. Because we don't know how long the natural immunity will last. Yeah.
Thank you so much. I just also want to remind those watching online that there's a number running down on your screen that you can actually call in and ask Doctor any question that you have. Thank you. Anybody has any questions in-house?
Yes, I have a question, and I think by answering Mama Betty's question, you answered my question. That was, how long does the vaccine last in our system? And I think you said, right now, we don't actually know.
Yeah. We don't know, but we believe that with time, it may be a lifetime. That's why you see that because it's a new disease, most of the scientists are saying that we don't know how long that even this vaccine that we are receiving, if we are going to have it as one time in our life, like, people get measles shot and they have lifetime immunity. Nowadays, there's only few people who get their immunity way away and then they have to get a booster. So we may be lucky that if most people get vaccinated and then we develop immunity, hopefully this thing will be a lifelong immunity that we may not be able to get another vaccine anymore. Yeah.
Thank you, sir.
Yeah, I think somebody was asking about the side effect of the vaccine.
Yes, sir.
Yeah, you see, because of human beings, we have human variation. Everybody varies with the way that they respond to vaccine. For example, let's say that I got infected with the COVID and I have immunity. Remember that I said that we are giving attenuated, that's a dead COVID vaccine. So for those people who have got the disease and they are getting a booster, I call it a booster because they already got immunity. Some of them may not even show anything because they survived the disease. But for someone who never got anything, it was antibody negative, when they do the nasal swab negative, and they are getting first exposure to the vaccine. Some group of people may have mild condition, like maybe headache, like you are getting the disease, but it's like a milder version of it. Some people may be sicker than that because of, you remember that the vaccine was not made just only for the vaccine. They used other chemicals that were added to it. Some people may have an anaphylactic reaction, that their body will react against the chemical they use with the vaccine. So that's why sometimes some people, they feel dizzy, they feel mild headache and nausea. But on the whole, if you take about 100 people, only a few, you won't count more than 5, who have mild symptoms. I heard there's a story that, so they give to somebody and they die. Well, it can happen. Like I mentioned about anaphylactic reaction. Even common water, when you drink water, people can drink water and they don't wake up. Yeah, so I think that but a bad person will use it as a way to try to convince the masses that, you know that Madam K got it and then she couldn't survive.
Okay. So there's a question coming in.
Yeah. Hello, doctor.
Yeah.
This is Gimato. I would like to ask, if you take the COVID-19 vaccine, does that change the DNA in your body?
No, it doesn't do that.
Okay.
Yeah.
Thank you.
Yeah, it doesn't do that. You see, like I was saying, that there were some group of people who are going around trying to sell stories. That to just to convince people that when you do this, it's going to be. It's just like the way they talk about even the election. Like some people say, if you go here, somebody is going to attack you. They make you get excited so that you don't want to do anything. But I think, in a way, I took chance to walk. I don't want to digress from this. But I went to Yankee Stadium. They are giving the Pfizer vaccine there. Do you know what I saw?
Yeah, this is Gina calling.
Do you know the interesting that I saw? I saw a group of white people from upstate New York. White people who were coming there to get a vaccine. So I was asking one lady who was there, she said, I don't want to get it. I said, you see, this woman that you are seeing is white. The person giving you the vaccine is black. Why is it that the white person is not afraid of the black person giving the same vaccine from the same bottle? But you, the black person, you are afraid of getting the vaccine. And the woman was looking at me. I said, people from upstate, white people, coming all the way to Yankee Stadium to take the vaccine, you think that they are giving to black people to kill them. And the person who giving the vaccine is a black person. And the vaccine is from the same bottles that are arranged. Why are you thinking that these white people come in, theirs will be different from you, the black person? So these are the things that worries me about our own people, that we have the thing, somebody will go and spread something about it. Unfortunately, it has happened in the past, doing Jim Crow, but things have changed. We have gone through change. Things are still changing. We have got to a point of being become half a black president. Not all black people voted Obama for president. The whole American population for black people are about 13%. How can 30% create a black president? So it's not everybody who has a bad mind.
Sorry, but there's another caller on the line who has a question. Hello? May I know who is calling, please? Can you mention your name and where you're calling from? Did we lost that call? Okay, all right, so yeah, I think we lost the person. But if you are in here or online and you want to ask questions, this is the time.
It went off.
Hello?
Somebody want to ask a question.
Yeah, can I ask my question now?
Yeah, go ahead.
We wanted to know your name and where you were calling from.
My name is Gina. I'm calling from Maryland. I just have a question for the doctor.
Sure,
so my
please,
question is, How about women who are trying to conceive and having difficulties already conceiving? Is it safe for such women to take the vaccine? And what are the complications also if they should, if they go ahead and take the vaccine? That's my question.
Okay, the recent data from American Society for Obstetrics and Gynecology, they came out with a notion that they want or they encourage, they are not saying that they are pushing every woman to get a vaccine, but from their data, they're saying that it will be wiser for a woman who is pregnant or about to get pregnant to get a vaccine, because if you are pregnant and you get COVID, the chances for them to even consider you to be on a ventilator, the complication may be more of a problematic than you getting the vaccine. So they are encouraging women who are pregnant and those about to get pregnant to get immunized so that they don't get a COVID whilst they are at the point of delivery or during the course of their pregnancy. That is a recent data released by American College of Obstetricians and Gynecology. They are encouraging, but they are not saying firmly that they must. But looking at the data now, they feel that it is beneficial for them to get a vaccine before and while they are also pregnant.
All right, audience, in-house. At this point, I would like to encourage you to ask all your questions. Don't be quiet. Everything that is bothering your mind, this is the time. We have the resource here. We want to make use of it. So please, Sister Paulina has a question.
Okay, doctor, initially when the COVID started, the doctors were prescribing the azithromycin and the chloroquine for the patients. So right now that we have the vaccine, I want to find out if you still prescribe that or you encourage us to go get a vaccine when we are positive.
You see, when I started talking from the beginning, I said that it's very hard for scientists to develop medication for viruses. What we were doing initially were all trials. There wasn't any specific thing that, okay, chloroquine was doing this. It was the data that some group of people were getting some results in a small study. But later on, they found out that it was causing heart conditions for a lot of people. And even, I forgot to mention that for those people who have even survived the COVID, as I'm talking now, some of them are still having lingering conditions like chest pain, dizziness. Some people have unexpected movement of their body and all that. They're going through a lot of things that is new to scientists. Even myself, I've sent 5 of my patients to cardiologists for chest pain. They didn't find anything. They ended up giving them blood thinner. But we don't know what is actually causing. It's still undergoing some research. But presently, what we all know, that because people die of pneumonia, because of the part that is built up in the lungs, the studies have shown that azithromycin gives some help. So that's why you see that when people get infected, most physicians prescribe azithromycin, and in rare cases they give prednisone, depending on your condition, and they give Tylenol. Even studies show that if you give initial infection with ibuprofen, it makes the condition get worse. So the actual treatment, like to give a particular medication, like you have a urinary tract infection, we give you antibiotic. For COVID, the vaccine and even facial covering will be the best than you trying to get medicine. Yeah.
Thank you.
So please, what is your advice for also the home remedies that we were doing, like, excuse my language, like drinking sobolo and those things? What is your advice? Do you advise us to go on to do it, or we should do what? Thank you.
You see, as a scientist, I believe in evidence-based medicine. But growing up, I see that there are things that our parents did that even though it wasn't following a particular trend, it was saving life. So the sobolo thing that I'm saying, I'm not going to say that you shouldn't do. Studies have shown that anything that give warm, like heat, try to help suppress the virus. So you see that most people were using heat, they cover themselves. It sort of helped the recovery. But I'm not going to say that if you have recovered, some of the people were doing the poon or whatever they call it several times, even every day, every second. And you realize that they sweat so much that they lose so much volume. So their body gets dehydrated. And remember that 60% of more of your body is water. And if you're going to lose so much water, you may even end up passing out. So I'm saying that you can do it. The natural remedies are good, but don't overdo it. Yeah.
All right, doctor, somebody has a question. And the person's question is, can the vaccine help cure the new variant that is coming? Every day we hear of a new one.
Well, you see, the thing is that the virus keep on changing. And for what we know now, there's a strain from South Africa, and there's a new strain in Europe. But they found out that Janssen J&J vaccine was able to do more good with the South Africa variant than the newer one, than the previous one, the Moderna and the Pfizer. But it doesn't mean that you have to, because we don't know a particular vaccine that will kill or destroy the whole COVID vaccines, we shouldn't get the vaccine. Like I was saying earlier, that even the flu that we have known for years, every year we change the vaccine, and still only 40 to 50% is effective. So looking at what we know in the past, this is, to me, it is a great thing that God has innovated people to do. So regardless of whether we are able to create newer vaccines to destroy the virus, I think that the present one that we have is good until we get the ultimate one that will take care of everything.
I have a question.
All right. So before that, there's a question, are the children's vaccination out? And I know it has age variation that you have to be 18 and up. Do we have vaccine for children?
For now, as I'm talking from today, the FDA has never approved vaccines for children 14 and above, below. They have a group of children that are going through tests. They are trying to do people who are on trials to see whether they have parents who volunteer their children for them to be vaccinated with the virus, the vaccine. So they haven't come out with a guideline as to whether children below 14 years should get a vaccine. But as I'm talking to you now, anybody above 18 is recommended to, if possible, get a vaccine. But for children, it's still something that they are talking about. Yeah.
Somebody has a question in the audience.
Okay, doctor, please, I want to know the science, like, what is the science that you see that maybe you have the COVID or no? Because some of us, we get headache, we get feverish, and all those kind of.
You see, like when I was talking from the beginning, the COVID virus initially presents like anything. Some of the things we didn't even know. Somebody say, I can't smell, I have headache, common cold, and all that. The only way that can make you prove that you have COVID vaccine is only when we do the test. Because initially, when it presents like normal common cold, cough, the way that I think the newer thing that they've added, which was not able to smell, which you won't see it in common cold and other stuff. So to prove that somebody has got the COVID, you have to do the test. But the symptoms, you can't use symptoms alone to say that, okay, I saw Paulina was coughing and having fever, so he has COVID. No, you have to do the test to prove it. Yeah.
I have a question.
Yeah.
So, Doc, thank you so much. And I think you are recommending us to take it. My question is, I believe there are a lot of ingredients in this vaccine.
Yeah.
At least, there is only one ingredient in this vaccine that is harmful to the human body. Although the good ones will surpass the bad one, but at least is there one ingredient in this vaccine that is harmful to human body? That's my question.
Well, the thing is that it's a very good question. You see, when I was talking, I said that the natural immunity is always the best. Like, I got a disease. Initially, when it happened, my wife would tell you, I was coughing and all that, doing all these things. But I survived. I took the blood, and I found that I have antibody. So that was the natural immunity. That one was something that God gave to us, that our body fought and produced antibody against. The vaccines that we are creating, they cannot stand on their own. They need to be mixed with something. Whatever that we are mixing, we hope that some of the ingredients that we are adding may not cause any harm to us. But unfortunately, there are human variations. There are people that when they take aspirin, they will cough. Some people will take Tylenol, they will have anaphylaxis. Somebody will take penicillin, they will have. So even though there may be something that can cause something in the vaccine, the benefit of you getting the vaccine outweighs for not taking it. So that's why I'm saying that. I always tell if you ask Paulina, I tell her, I say, even when you are drinking water, you have to stop breathing. There's no one who drink water and breathe at the same time. So after you've drank the water, you see that you are panting, meaning that you lost some oxygen. So even something doing good to yourself, you will still even have to go through some punishment. So all that I'm saying is that we have to weigh everything. From what we all know now, the vaccine, with the little time that we've got the vaccine, it has changed a lot. If you follow the data, the number of people who are being hospitalized is dropping. People who are dying is dropping. People who are even some ignorant states are already opening when there's no time for them to do. So it shows that the vaccine does some good. Then look at the 500 over people who have died. We are not seeing it now. So I think that we cannot say that it's 100%. The 100% vaccine is the one that you got the disease and then you have the immunity. And it's not everybody who will get it and survive. Some people, they may not be lucky. Yeah.
All right. So there's another question for you, doctor. What is causing the new variant?
Well, you see, the cause of a new variant is it's very simple to explain. It's just like you want to kill me. I've seen that anytime you want to throw something at me, you face me like this. Okay, so I see that, okay, Paulina, look at me here before you shoot. This time I'm going to move my head like this. The virus, with time, they try to modify themselves into something. So whatever that we are creating, remember that human beings, we create something like this, it's fixed. When they see that it's coming out like this, those ones that are coming will say, okay, this time I will switch because I see that my ankle went in and it never came back. So then why don't I squeeze myself? So then it didn't form a good receptor for the vaccine to catch it. So it is the changes that the virus is going through with the way we do stuff. Like I was saying, that the variation won't change because if you look at the flu vaccine, every year they change the way they present themselves because every year they change the way the flu vaccine behaves. So they have to study the variant that are available and create a vaccine for it. So if you want to say that you can get something to mop a particular vaccine, you don't know how the following year the other vaccine, the other virus will create. So it's very difficult to say that I can have something that will maybe to mop a particular thing. The virus will keep on changing. Yeah.
So, doctor, do we have to keep coming up with vaccines for each one of them?
Not really. What is happening is that with time, you see, with time, if we are able to do well with the good vaccine, and then we vaccinate most people, I think you heard about herd immunity. The virus becomes useless. Initially, when you look at other vaccines...
Doctor, sorry to interrupt you, but there's somebody on the call. Hello? Hello? mention your
Hello?
name and tell us where you're calling from?
Hello?
Hello? May we know your name and where you're calling from?
Hello?
Hello? Can you hear
Yeah,
me?
can you hear me?
Yes.
Yes.
Tell
Okay,
us your
my
name and where you're
question
calling from.
is, I don't know whether maybe someone has already asked, but I was hoping if, Doc, you could explain how the messenger RNA works, because, initially a lot of people, there was so many conspiracy theories about the vaccine interfering with your DNA, and also some news that when when you take the vaccine and you get sick, or maybe there's nothing that can be treated and stuff like that. I would be glad if you could explain how the messenger RNA works, how when you take the Pfizer vaccine, how it works compared to how the Johnson and Johnson also works, and how it's not going to interfere with your DNA and stuff like that, so that people could clear up their mind a little bit about the vaccine.
You see, like, if this is very easy to explain, but I'm not going to go into a detailed scientific thing to confuse people. What I'm trying to say is that if you take the virus as an entity, anything that doesn't belong to our body, when the body recognizes something that it doesn't belong to the body, there's we have cells within our body that will recognize this, go to the bone marrow, go through some process and produce antibody against it. The detail is that is how all vaccines are supposed to create. They are created such a way that you have the dead vaccine, the dead virus, which in actual fact will have caused, if it was alive, will have caused the disease. Okay. That we take a part of it, then we create the vaccine. Then when the vaccine is introduced to our body, because our body has to recognize that there's something that doesn't belong to our body, then the body will try to produce antibody that will fight for us. But the theory with this messenger RNA going to interfere with our DNA, if this is going to confuse you, then you are going to have the idea that all vaccines are not necessary. It doesn't have to be with COVID vaccines. Then the ones that we are giving to our children, like measles, chickenpox, hepatitis, they all follow the same pattern. But because people are going around with conspiracy theory, and because this one has become so quick to produce, that is why they are trying to say that this one will go to your body and create a variable version of a messenger RNA, and then this one will change your body so you don't become who you are. It is just innovation. Science is changing, and it is changing. It may go in the wrong direction. People may abuse it, but presently with the condition that we have now, this is the best thing we could have. So regardless of whatever conspiracy theory about people talking about messenger RNA, DNA reversal and all those things, they are not necessary. You're only going to confuse yourself.
Right, sure. I have another question for you, Doctor. Does the antibody last in your body?
Okay, I think that I did answer even from the beginning. That it's initially, this is a new disease that is coming. We don't know, but we hope that it may last for long. Initially, when people got antibody testing came out, Korea, they found out that some people, I think you heard that some people even got a second COVID. They got COVID and then they got another COVID. The vaccine, people were saying that the antibody lasts for about 1 month. But what they forgot to mention was the people who got the second COVID, what is their immune status? The key thing is for you to be somebody who is not immunosuppressed, like somebody who is not diabetic, somebody who is not a cancer patient, somebody who has not organ recipient, and somebody with not HIV. We hope that if you get exposed to the virus, the vaccine, the antibody that you create naturally will last for a while. That is why most scientists are saying that it's better that even though you got a disease, it's better that at least you get a booster of one vaccine so that maybe you may have a double dose of your immunity. So what I'm trying to say is that this disease is a new thing. It's going on, it's changing. Even next year, if you ask me to come and talk, I may even change some of the words that I said now because it keep on changing. But what we have now is that we have got a vaccine that is doing good than doing bad to us. So we should encourage our people to have it.
All right. We have a question in the audience.
Thank you, doctor. My question is, if I'm going to get a vaccine, I have a choice to choose which one I want to get. If I want JJ or...
Well, I cannot recommend that this particular one is better than, as far as I know, or even if I say Pfizer, if I say Moderna, if I say Johnson & Johnson, for each one of us, our body variant, some people may do well with Pfizer, some people may do well with Moderna, somebody will do well with J&J. The convenient part is you have to decide which one you think it will be available to you and what you, but presently, I think all the 3 vaccines that we have available now is good. I just learned before I came that Britain, they held AstraZeneca. They were giving AstraZeneca vaccine, but they found out that AstraZeneca vaccine is not helping the new variant that they have. So they put a stop to people who are receiving AstraZeneca vaccine. That, anyway, by the way, that's what Ghana, we got it anyway. Yeah, that was a gift to Ghana. So, yeah.
All right.
So I can tell you that for now, you should get the one that is available to you. All of them will be good. Yeah.
All right. All right. We want to take our last question from the audience.
I know that, doctor, I know that Moderna and the Pfizer is 95% effective, but the J&J, they say it has lower percentage. So how can you educate us about that?
Well, it all depends on the make. You saw that the J&J is a single dose. If somebody is giving you 1 dose and somebody is giving you a double dose, hopefully you will know that the double dose may do more good because you got one and your body has recognized the second one. But they are all stored differently because J&J can be stored in a regular fridge. How they did their research and the trials that they've shown that it does well with people who carry the South Africa strain and then the ones that we have here. But what I wanted to say is that the percentage is good, that is 84%. But if you see yourself that if you live in America here and you work in any health institution, flu shot that we know that the best that flu shot can do for you is 50%. You are forced to get it. So if you get something that will give you 84% success rate, I think that these 3 vaccines, they are doing good for us because we're still getting flu shot, which is still people will get the flu shot and they still get sick. And it's still a must that if you work in a nursing home or you work in home health services, if you don't get a flu shot, they won't let you work. And they know that people will get it and they'll still be sick. So looking at all this picture of even the previous vaccines that we have studied for years, I think that if you compare how people have died and the benefit that is coming with this, we should be thankful to God that is doing some good to us. But some people are not appreciating what God is doing, so they would rather say that, oh, it was maybe Tony and other people who has mixed something and then they give it to, that's why they're getting 95%. It's never been that. But I think we are seeing the results. Joe Biden has been president for only 50 days. He pushed the vaccine. You see how the death rate, everything is going down and down and down. So the vaccine, I think, is a good thing. Yeah.
So, Doctor, there's one Moses from New Rochelle also calling in. He has a question.
Okay.
You're online, please. Hello? Hello?
Yes, I can hear you.
Yeah,
Yes, we can hear you.
Yeah, we are listening to you.
Okay, yes. So my name is Moses. I'm calling from New Rochelle. My question has to do with the BMI. I understand that for you to be qualified to take the vaccine, you have to have a certain BMI. If
Please,
I
can
do
you
not meet
speak
that
louder? We
criteria,
cannot
should I
hear
be
you.
concerned about that?
No, I think with the question, we are not getting you. If you can speak louder a little bit, yeah.
Okay, yes. So the question has to do with the BMI. I learned it's a
Your body mass
criteria.
index, yeah.
Yes, so if I do not meet that BMI number, should I be concerned? How does it affect me if I'm not qualified to take the vaccine?
No, I think that the key thing that we are all saying is that initially we were worried about people with underlying medical conditions. So in America, obesity, and whether it's America or anywhere else, obesity will lead to a lot of problems like metabolic syndrome. You can be diabetic, you can have high blood pressure, you can also have heart conditions, because if you are overweight than somebody who is not overweight. So there's no criteria saying that if your BMI is 22, you shouldn't get a vaccine. If your BMI is 20 and you are a cancer patient, you have to jump in the line and get your vaccine than somebody with a BMI of 30 with no disease. So it is what you have. That, because even most of my patients, there are some of my patients who have bad asthma, even though New York State, they are pushing people 65 years and older to get it. Because they have bad asthma and they have maybe organ transplant, I've given them letters so that they can get ahead and get the vaccine before the people who are even 70 years. So anyone who is telling you about the BMI, I think that is not a good analogy. You can have the vaccine at any time, but we prefer that those who are immunosuppressed, those who have underlying medical conditions, should get the vaccine first, because they are the people who are more likely to get sick and then have the bad end result than the average person.
Thank you so much, Doctor. It's been an amazing time. We have learned a lot. This is Dr. George Owusu of GEVANS Medical Practice. He owns his own practice here in the Bronx. Doctor, can you please tell us your address? Maybe people would like to come and see you.
Well my address is 1280 Gibbon Avenue. It's between Boston and Garney Road. And I'm on the website, www.givansmed.com. Yeah.
Sure. So if you want to go see doctor, that's where you can find doctor.
Yeah.
Very, very, very down-to-earth doctor. He's my personal doctor. All right. So at this juncture,
I think somebody wants to say
Oh, you have a question?
Yes, we have a question on YouTube that says, I am Commodore Besson, watching from Accra, Ghana. Is it okay to have a second booster shot if you have recovered from COVID?
Oh, yes. Yes, I think we even answered it from the beginning, that under normal circumstances, for most virus conditions, when you get immunity, you don't need a booster, because this is a new condition that we are all experiencing, and it's more deadly than other diseases. So for the time being, the expert, even I remember Fauci was on TV about a month ago saying that, like, those who have got it they don't need a vaccine booster, but he will recommend that if you have recovered from the disease, at least you should get one dose of either the Pfizer or Moderna. But like I said, very soon it's going to be like the passport, because going to other places, if you without COVID vaccine, you may not go, because if you don't have the certificate to show that you have received the vaccine, Ghana people will not allow you to leave America and say you come to Ghana. Otherwise, you continue to pay the 150 because there's research going on that they are thinking of if people get enough vaccine, they may take away the $150 if you can prove that you are negative at the airport and also you have received the vaccine so that you don't have to do the vaccine when you land Ghana. So it's whether even you think you are macho, you are not going to have the disease, I think it's advisable. And even with the recent data from Pfizer, that if you want to be a good person to help protect other people, if you receive the vaccine, you decrease transmission to those who are liable to get it about 95%. So I think all of us want to be good to others. So I think we should get a vaccine.
Okay, thank you so much for your time, Doctor. We truly appreciate you, after a hard day's work, coming to educate us. This is our Royal Ladies, like I said, maiden event here in New York, Lateran Center. We believe in educating our members, especially our women, because it is said that you educate a woman, you educate a community. To our online viewers, we want to thank you and appreciate you for tuning in. I hope this has been very beneficial to you. Just watch out for the next educative program from Royal Ladies Lateran Center. Thank you, thank you, thank you.